Was there anything in here to indicate that she was alive at the time of dismemberment?
Well, the body sounds like it's in a state of postmortem decomposition with some loss of integrity of the skin surface and some bloating and skin slippage, and etc. But despite that, the medical examiner was able to identify two wounds that penetrated, meaning they went into the body, significantly into the liver, which would bleed a lot, and significantly into the lung, the space around the lung, which also would cause a problem with air and blood accumulating there. And if it were a freshly deceased person, perhaps the edges of the wounds would tell you the weapon much more clearly, but it's more difficult in a decomposing body. But they are trying to generally describe the wounds and the shape without saying it's absolutely a knife that did this.
And to be clear, I'm glad you mentioned that, because earlier in the week, when they talked about the charges and the special circumstances, it was very specific, a sharp instrument they claim was used. They didn't say it was a knife or an axe or something. There are two penetrating wounds of the torso with smooth edges that may represent sharp force injuries. So in other words, is there room here to suggest that it was something else?
Something that was sharp enough to penetrate skin and underlying tissue and go into the liver and then into the space around the lung. Is it, what exactly is it? That's really the question. And I don't know that they'll be able to say exactly the weapon that was used.
Is there anything in here to indicate that she was alive at the time of dismemberment?
It sounds like classic amputating the body to try to compact it, to hide it, to dispose of it. I've seen that in a number of homicide cases. So nothing that suggests that these amputations occurred while she was alive.